So we'll go ahead and get started, and if anybody else joins, they can just jump on in where we're at. Again, my name's Taylor McDonald. I'm with CSG Actuarial, and today I'm going to be walking you through all the different tools that are offered through MedicareCompareUSA's online tool. And in exciting news, we will be also walking through the brand new Medicare Advantage and PDP quoting tool enhancements that allow you to actually add in a person's drugs that they're taking, as well as what pharmacy they go to or their preferred pharmacy, so that you can actually see the cost that you would have to pay for these plans or what they would pay for their co-pays for these drugs. So it is going to be an all-encompassing presentation today. We're going to walk through all the tools, and we will have questions at the end. So feel free to raise your hand. You can do that on a feature here for this webinar. Raise your hand if you have a question, and we will definitely cover those at the end. You can also feel free to chat in any questions, and we'll be sure to cover those. Again, this is going to be recorded today, so if you would like to view this after, we will be sending out a recording. We're going to start today with the Medicare Supplement Quoting Tool. So if you're new to the tools, we're going to cover everything. So we'll jump on into the Medicare Supplement tool. We'll start by clicking Run Quote. And here you will enter your zip code, your county, age, gender, tobacco status, and how you'd like to sort the results by for your client. We can also choose our plan type, effective date, and household discount. So we'll start by entering our zip code. We will enter our gender, tobacco status, and plan type, as I mentioned. And you can also click this Show Advanced feature. So with this quoting tool, there is an underwriting filter included. You can add in a person's health conditions or medications that they're taking. And if you click Add Filter, it will go ahead and add that to the quote. Maybe we have this medication that we're taking for this disease. We can click Add Filter. If we added something that we want to remove, we'd click this X. And then when we click Get Quote, it will include any of those health conditions or medications that we entered. We also do have this Client Manager feature. So if you have a client that you've already saved, which we will get into the Client Manager feature a little bit later in more depth, but maybe you've already created a client, you can certainly select a client from your drop-down and it will pull in their information. So for example, it would pull in their zip code, age, gender, tobacco status. It will pull in everything about this client. Or we can actually create a new client. So maybe we want to say, I'm just going to call it Friday Test. Happy Friday to everybody. So if we click enter that name again, we'll say Friday Test. Then we can click Create New Client. And then this is a new client created in our Client Manager, and it will save all this information that we entered for them. So we'll go ahead and hit Get Quote. And now it will show us the results for Medicare Supplement. And it will also include any carriers that would accept diabetes as a condition, and they would be able to apply for this plan. There is a way we'll see here once our results load. It shows that these carriers listed below accept the following health conditions and medications. We have diabetes. So we can see all the results listed here for MedStep. If we want to take off that underwriting filter and see an unfiltered view of all the carriers that are available, even ones that may not accept diabetes as a condition, we can just unclick underwriting filters here and it will remove that condition or medication and show us the full results. We can also, on the left-hand side of the screen, we can expand or contract quotes. We can apply discounts. We can see the annual rate. We can also see market analytics if we'd like, and choose if we'd like to include select plans, and again, the underwriting filters we went over. We also have the option here to have application health questions on the left-hand side. So if you want to select maybe a health condition here, like any heart condition, it will show us the look back period for that condition on the carrier's application. So as we scroll down, we may be able to see one. If I picked a correct one, that would pull in anything, maybe arterial fibrillation, and it would show the look back period. So an example here, Independence American, it shows the last 3 years. It will ask if that person has had this condition in the past 3 years, and that's how we know what type of questions will be asked on that application. I do see that we have a question here from Alex, so I want to make sure that he has an opportunity to ask that question. Alex, do you want to go ahead and unmute yourself and ask a question? Okay, maybe he doesn't have a question. It looks like he had a little question mark by his name, so I thought maybe he does have a question. Feel free to jump in, Alex, if you want to go ahead and ask your question anytime. Okay, so here's all of our results again listed. We have a lot of different information that's populated underneath each of these plans. I'm going to scroll back to the top. And the three big pieces that we can see here that is really helpful when working with your client is age increases, increase history, and market data. So I'm going to scroll to one that has the increase history here loaded in. I guess it's for these 65-year-olds. So let's scroll down to State Mutual Insurance Company. So we see the age increases here are listed. We obviously ran a quote for a 65-year-old. So it also includes a 66, 67, 68, and 69-year-old and what the price is. So what this tells us is right now, what does someone who is 66-year-old pay for this plan? What about someone who's 67 years old? What would they pay for this plan? So what that tells you is as the person ages, what can they anticipate they may pay? So it looks like for this plan, a 66 and 67-year-old pay the same price as a 65-year-old. So that's good for them to know. Their price probably won't increase. Again, it's based off current plan rates, so this could change. But then we see when they turn 68, 69, the price starts to go up a little bit. The increase history tells us just that. What increases to the rate or decreases has this plan taken, and then what's the average of those increases or decreases. And then the market data shows us on a national and state level the number of lives that are covered, the premium amount, the loss ratio, and the market percentage. We can scroll between years, and then we can compare how this may have changed year over year. And if we ever get confused about what any of these pieces of information mean, or maybe where this information is coming from, if we scroll down on the left-hand side of our screen and click About Quote, we get this nice little cheat sheet that comes up, and it gives us definitions of the age increases, increase history, covered lives, market percentage, premium amount, and loss ratio, and what the sources of those data pieces are. So good to know there. If you ever forget, we have a guide for you that will show you. Another thing that I want to show on this Medicare supplement tool, which we can do for all of the quoting tools, is our compare quote feature. So if you want to compare up to 5 at one time side by side, you can click the plan name. It will turn green. I'll select 2 for this example. And then as we scroll to the top, these plans are populated under compare quotes, and we can always change these or remove them if we need to. But then when we click compare quotes, it will show them side by side, a side by side comparison maybe of 2 plans, again, up to 5 that we would like to show for our client. You can always print this, or you can click this PDF button, and it will do a PDF download for you of this comparison. Or if we want to see our entire list exported, we can go back to our full result list. So I'll click the back button here. And then when we're viewing our entire results list, I can click export by print, export by PDF, or Excel, and it will export the entire list here of these results. So really nice that we can export this and create a professional PDF to send to our clients or share with them later. And we easily do that by clicking the export options. The next thing I want to touch on is the Medicare Supplement E App very quickly. So if I scroll down, I'm going to go to United World. If I scroll down, you can see that we have this Apply Now button listed for United World Life. So we can click Apply Now. This is the MedStep E App, and you'll notice it will take us directly into the CSG e-application for Medicare Supplement. So you don't have to leave the website. It takes us right into it. If it's the first time that you're doing a application for a particular state, for a particular carrier, you will need to validate your name and producer number. You can see that mine auto-populated because I have done it in Nebraska for United World before, so it remembered me. And then it will take us right into the application. So we'll start by answering these questions. I did preload one of these, so we don't have to go through every single section. Most agents are probably familiar with what is shown on the e-application or what questions are asked, but I wanted to show how you can easily go into the MedStep E App. So you'd click continue through any of these different sections, and you'll get a green check mark once they're all complete. You can see I've almost completely completed this application ahead of time, but it's a very fast and easy application to use. It's the same process for any carrier. The questions will be different, so if there's any specific questions that are carrier specific, those will be reflected. And it's also a smart application, so if we change anything, maybe we change from a plan G, which we quoted, and we say, actually, we want to do a plan A. Maybe we totally change our mind. You can see that this updates over here on the right-hand side and our price adjusted. Similarly, if it's an underwriting case and we select any health conditions or medications that would make us not eligible for coverage for this plan, we would get a notification appear at the top that would tell us that this applicant is not eligible for coverage. So we have a couple different signature methods. You can either do a wet sign at the end, you can do a PDF download. It will fill the app for you. You can sign it with a pen and you can mail it into the carrier. But most of the time, we're going to be wanting that e-application functionality, so then we can do an email signature. It will email your applicant with a link and a verification code, and all they'll need to do is click that link, enter the verification code, and then it counts as their signature, and it's submitted directly to the carrier. So once we've submitted the application, what happens to it? How do we check up on it? So we can go to our e-application dashboard. We'll click View Active here, and you can see that these are the applications that I've started. They are incomplete because I did not submit them yet, but it shows us the summary of the carrier, the applicant's name, the status, the created and last modified date, and we can also just click Edit to go back into this application. So if we start it, we need to finish it later, we'll click Edit and we can resume the application. We can also delete these out if we need to get rid of them. But once we submit these applications to the carrier, you will get a policy number listed here. So it will say submitted, it will be green, and there will be a policy number. So that way you can track the application with the carrier at their website. So that's a high-level overview of the MedStep E App. Let's move to the next piece of the demo here. We're going to go to the final expense life quoting tool. So we'll click Run Quote. Again, we'll enter on this first page our client's zip code, age, gender, tobacco status. Again, we can pull in a client that we've already created or create a new client if we'd like. We can also choose a face value or monthly rate. So we can choose to enter that face value, or if they have a budget, maybe they want to stay within for their monthly rate, we can enter that here. You can also choose a product type and underwriting type, so full or guaranteed. And then we can choose how to sort our results by. We'll hit Get Quote, and we'll see all of our results listed here. What did I do? Silly, let's see. Nothing for the search criteria, so let's switch it up. Wait for it to load. Okay, so any of our graded benefit plans here would be listed. You can see they're sorted by monthly premium again. We can see if there's an annual fee. We can apply those fees on the left-hand side to see what the cost would be with that fee. It shows the information about the plan here, and we can click Quote Options to view the plan details, and it will take us into these plan details of the single plan here we'd like to view. We can click PDF or print if we'd like to do that for this particular plan, or we can go back to our full results list. And again, like we did for MedStep, we can export the full results list by exporting, by printing, or doing the PDF. So all those options, no matter what product you're quoting, still stand. So you can certainly use the functionality across all the different quoting tools. We'll go to hospital indemnity next. Again, we can pull in a client or enter our zip code. And you'll start to see that once you get the hang of one of these quoting tools, they're all pretty similar. So it's very user-friendly to quote all the different products on one platform. So for hospital indemnity, again, we can export our results. We can expand or contract our plans here. We can see if there's a household discount or policy fee, and we can see more quote options here. We can click Visit Carrier Resources, and it will take us to that carrier's login page. That's a very quick way to access the carrier's website. Again, you click Quote Options, View Carrier Resources. You can also click View Plan Details and see your individual plan that you'd like to see. And then you can also, for hospital indemnity, change any of the benefit amounts. So you can actually customize the exact coverage you need for hospital indemnity. For example, this benefit amount is $50 a day here for $50 for 3 days. If we want to change that, let's make it really big, maybe go up to $100. You can see that it will change the price here, and it will show you how much the cost will increase or by what amount. So you can actually do this for all the different benefits and really customize the plan for your client. So very interactive here for the hospital indemnity quoting tool. Again, you can do a PDF or print, and we'll take us back to the full results here. The next tool that we'll go into will take us back to the dashboard. We'll go into the dental quoting tool. So again, we'll click Run Quote. We'll enter our zip code or pull a client in to auto-populate our quote parameters. You can choose here how you'd like to sort the results by again. So we've got price, we're covered members, product filters here, everything's there. We'll hit Get Quote. And again, very similar to the other quoting tools, very similar format where I'll show the full results list. We can do the same compare quote options that we did before. Again, if we want to do the e-application, we can click apply now, and that will start the application right here for a general e-app, which is a very similar process for as we showed for the MedStep. And then we can also do an add to cart if we would like, and we could add, let's say, a dental plan and a Medicare supplement plan at once, and then we can go through those together. So maybe we can pick a client, or we can create a new client, and then we'll start the cart. So another feature that is available is that cart functionality. And then it will take you through the app at the same time. So maybe we want to do a MedStep or dental together. We can go through those at once. So that's a very nice feature to have there. And then we also will go back, we'll go into the, let's actually go back to the dashboard, and we're going to go through the Medicare Advantage quoting tool as we know it today. I want to make sure that we have plenty of time to go through the new Medicare Advantage features as well, but let's go through the Medicare Advantage tools we have today. So I just clicked the normal Medicare Advantage plan from the dashboard. We'll enter our zip code. We can choose our plan, so Medicare Advantage, Medicare Part D, or Special Needs Plan. We can choose how we like to sort the results here, or filter these, so HMO, PPO, Enhanced Drug Benefit, or No Drug Benefit. And we can also choose if there's a low income subsidy level we'd like to see, and then we'll hit Get Quote. So again, this is the original Medicare Advantage or PDP quoting tool. So if you'd like to do any of the original features that we have, you can use this tool. For example, you can go into View Plan Details here. And if we want to do a fill the gap, we will want to use this original Medicare Advantage or PDP quoting tool. So we'll click Show Additional Details, and I'll show you this fill the gap feature. So you can actually run a hospital indemnity plan within the Medicare Advantage plan quoting tool. So if you run a quick quote here, you can select whatever hospital indemnity plan you want. Maybe we want Medico. We can click Add to Comparison. And what it will do is show a side-by-side of our Humana Medicare Advantage plan and our Medico hospital indemnity plan. And as we scroll down, we can see how we can fill in the gaps or fill in the coverage gaps of our Medicare Advantage plan with our hospital indemnity plan here. And we can choose our different benefit amounts. Maybe we want to increase different benefit amounts or fill any of the coverage gaps here. We just select the benefit amount, and it will show us how much it will increase the cost. So that's the Fill the Gaps feature that's available in our original Medicare Advantage plan. Again, you can do a print or a PDF of these two plans side by side. You will want to use this original plan here, the Medicare Advantage quoting tool, if you want to do the Fill the Gaps. And then the new Medicare Advantage features, if we want to get to those, we would use a new plan, which I'll jump into in a second. Another feature that we have here with the original Medicare Advantage or PDP quoting tool is you can click Plan Details, or you can click Visit Carrier Resources, which allows you to jump directly into the formulary website, pharmacy website, or physician lookup for Humana. It will take us directly to that website. So those are our quick links here that are available. I'll take us back to the dashboard, and we'll start now with the new stuff. So everyone's excited to see the Medicare Advantage ability to add in the prescription drugs and pharmacies. So let's get to it. This is the one you'll want to use. So with this green little icon or indicator here that says V2 Beta, this is what we want for that new Medicare Advantage or PDP quoting tool that allows you to add in the drugs and pharmacies. So make sure it has that green icon for the new tool. So here we go. It's very similar to the previous tool where you'll enter your zip code, you'll select the plan that you want, the effective year, how we'd like to sort the results by, the low income subsidy level, so we can select that here if we'd like to. And then here is where we will select our prescription drugs. So we'll select yes to show the drug cost. We can choose our fill method, so we can do retail pharmacy, mail order pharmacy, or both. Then we'll click Add Prescription Drugs. So this is where we'll add in the drugs. We can search any drugs that we would like, and you'll notice that when we enter this here in the drop down, let me see, I'm going to refresh my page. As we enter any of the drugs or we start the search, it will populate those drugs in there. So select the zip code. Let's start again. I'm going to select yes. We'll say we want the retail pharmacy, and then we'll add in the prescription drug. So as I start typing, you'll notice that any of the drugs that have these first few letters pop up, which is really handy. I know I'm not the best speller when it comes to these drugs, so as you start typing, it will populate those drugs for you. You can choose whether you want the generics to show in this result list. So any of these that say Trulicity after the drug dosage they're the brand name drug. So if it just says this actual drug name, then we know it's a generic. But any of them that have that brand name here listed, we know it's the brand name drug. So the generics are an option here if you want those to be populated in the results. We can choose the packaging. So for this injectable drug here, we can see that 4 syringes come in 1 carton. And then we will want to change the quantity because you don't want 30 packs of this. Normally it will populate to 30 for, let's say, our oral medications or tablets, but make sure that you pay attention to that quantity. If you need just 1 carton per month, you want to change the quantity to 1. And then we can choose the frequency of this drug. So monthly, every 2 months, every 3 months. And then you can keep this open and add multiple if you have multiple drugs. So we'll go ahead and click Add Drug. And then we can also add in our pharmacies. So we'll click Edit Preferred Pharmacies. It will pull in Google Maps here for us. It will populate the zip code we entered in the search radius. Will default to 10 miles, but if we're willing to drive a little further, we can click 20 or 50. And then we'll select the drug or the pharmacy that we want to pick up our drugs at and see maybe how the prices can vary for different pharmacies. So we'll select 2 here. We'll click Add Pharmacies. And if we ever need to remove a drug or pharmacy, we'll just click those X's and we'll hit Get Quote. Now, how are these drugs in pharmacies saved? That's a big thing. Some of your clients may have 6, 7 drugs, and we hear you when you say that you don't want to be typing these in every single time or adding their drugs every single time you run a quote. There's got to be a faster way, and there is. So if we select a client from our drop down that we've already entered these drugs for, so notice here I did not enter a client's name yet, but maybe I want to do, I did a test ahead of time for you. MedicareCompareUSA client number, we'll say that they're number 2, and we'll click Create New Client. Now, the next time that I pull this person up, this MedicareCompareUSA person number 2, it's automatically going to pull their drugs in. So I want to select that at the beginning, but let's say I want to select a different client that I've already done. So maybe I want to select Joseph Smith. Okay, notice when I select Joseph, his 2 drugs populate and his preferred pharmacy populates. So no matter who I select, if I've entered drugs in them for them before, it's going to automatically pull up their drugs. Maybe Joe next year, we're working with him and he says, now I'm on this additional drug. Okay, well the next year when we quote him, his previous drugs he entered pulled up and we can add in additional drugs. Maybe he's on a new drug now. Once I add in that drug, it's going to be saved in there. So then next year when we run the quote for him, his drugs automatically populate. So that's how the drugs are saved. Same with the pharmacies. So you don't have to enter them year after year. They automatically populate when you select your client up at the top of your list. So let's go ahead and see how these results list out for us. So let's hit Get Quote. You can see all the different plans that are available. It will show the plan name, the health and drug coverage here, what type of plan, what it covers, what drugs are covered under this plan. So we entered 2 drugs, and you can see here that it says 2 of 2 prescription drugs. That means they're both covered. It will show the health max out of pocket for this plan, the drug and premium costs. Again, I picked really pricey drugs and I didn't select the quantity, but it would list here for you for the price here, the drug and premium. If I click Show Details, it will show me my plan information. So that health deductible, the low income subsidy, drug deductible, plan type, county, physician, retail pharmacy costs, all this information. And then you'll notice here that it lists the different drug tier pricing. We still have that county enrollment and company enrollment. And to see those drug costs, we'll want to click the actual plan name. So these are expanded to show the details, but if we want to see the costs or those copays, we'll want to click on the company name, and now it will show us an overview of the plan, different plan details here. And then if we click benefits and costs, it will show the different benefits. So ambulance, annual physical exam, comprehensive dental. As you scroll down, you'll see all the different benefits. And then the real thing we want to see here that everyone's probably most excited about is our RX drug coverage and cost. So it does show us the tiers and what the costs are for these different drug tiers. As we scroll down, we can see our selected drug details. So we have Trulicity and Truvada here. You can see for each of these what the drug tier is. So we can see our Trulicity's in tier 3, and the Truvada is tier 5. It shows the client drug cost per selected pharmacy. So Shopco is going to have one cost. And if we added another pharmacy in here, it would show their cost. So you can compare the different drug costs at each pharmacy. Maybe one's a little bit cheaper, and that's how you can pick where you should maybe go pick up your drugs for your client, or your clients go pick up their drugs. As you scroll down, it will show the estimated drug cost per month and also the cumulative drug cost per month. So coming up on April here, it's each month this cost, but as we go through each month, what's the cumulative drug cost that we're going to pay? We'll scroll back up to the top and click on carrier resources. This will show the carrier's information so we can see what their address is, the member phone and prospect phone numbers. And then as we click on this website here, so we'll click AetnaMedicare.com, it will take us directly to this Aetna website. And this is where you can do the e-application for the Medicare Advantage plan or PDP plan. Then you'll just click log in and it will take you directly to that carrier's login page. And then you can do the e-application on their website. So if you want to do any sort of Medicare Advantage e-app, simply click login and it will take you right in there. We are working on the Medicare Advantage e-application to work as it does for the Medicare supplement. So that will be coming soon as we add more carriers. So stay tuned for that. I'm going to take us back to our dashboard here. We're going to go into our client manager. So we touched on this a little bit when running a quote, and we showed how you can select your client and it will pull in their drugs and their medications. So let's go into that tool and actually see all of our clients listed here. So as we click into view clients, you can see that all of my clients are listed here. I have some funny names created for them for different examples. We can search for any of our clients. So maybe I say, I've got Joe on the phone, he called me up. Let's find his information here. We can just simply type his name in. I hit something funny there when I'm trying to search for him. Forgive me for being a little fast on the mouse there. So we can search any of our clients. If we want to find somebody quickly in our results, maybe we have tons or hundreds of clients in here that we work with, we can easily search for them. We can also change how we view these options. So maybe we want to see their zip code and their tobacco status. We can select those and that will show here on this dashboard. We can click add a filter. Maybe we want to find all of our clients that live in Nebraska. Maybe we have a hot new plan that just came out in Nebraska, and I say I need to get in touch with everybody in Nebraska and tell them about this great new plan. We can search for Nebraska and it will pull up anybody that's in Nebraska here. So we can do multiple filters at once. Maybe we want Nebraska and we want all of our female clients. We could add another filter and just pull in our female clients. We can click into any of these clients here. So if we click Jane, we can see and update her information. So we have Jane Doe. She's a female non-tobacco user. We can update her information. Maybe we add a middle name, add her phone number and email address in here. We click save. We can also see any quote history for her. So if Jane calls us up and she says, I know you ran a quote for me last week and I know you sent it over, I maybe lost it, or can you run it for me again? You can see any of the quotes that you previously ran and click run quote and just easily rerun that quote for her. Or you can click new quote and it will take you to this new quote option here, and you can click Medicare supplement maybe, and then we're running a quote for Jane Smith or Jane Doe, pardon me, and all of her information populates. So you can go right from the client manager into a new quote for her. You can also add in any of somebody's current drugs that they have, or current plans they have, so current products. Maybe for Medicare supplement, this person has a plan F. We can say maybe it's with Aetna, and maybe they pay $100. We'll just make it easy. Then when we click save, we have her previous information in here, her previous or current plans in here, so that we have all of her information saved for her in one easy place. So that's our clients. Now maybe you want to create a new client. We can do that here by clicking new. Or perhaps you want to import clients. Maybe you have hundreds of clients again that you work with and you think, I do not want to create every single client one by one. Well, luckily you can import them. So if you just click import clients, it will map out your columns for you that you need, and you can just upload them all in one place and just one upload, and that way you're not creating these one by one. If you want a little assistance on how to import these clients, maybe how to map those fields, if you click training guides here, we have full tutorials of this client manager since it is a new tool, and we have this client import example. So I'll click this for us. There's also a client manager training guide. and videos on how to create new and upload lists. So those guides are available. I just want to draw attention to that. If you want to import a list of your clients, here's how you can map those out. So you'll want your columns up at the top to match this formatting, and then you can just easily upload these right to your tool in one easy upload so you're not creating multiple at once. If you ever have questions on any of this or uploading, let us know. Just with anything else in the tool, let us know if anything comes up or if you have any questions on doing any of these steps. The last piece that we'll touch on here is the electronic scope of appointment. So if you are trying to create a scope of appointment form, you can do that now on the tool. So if we click View List here, we'll go into all the electronic scope of appointment forms that I've either created or that are in progress. This is also how you'd create a new one for a client. So if you've got them on the phone and you need to create a quick electronic scope of appointment and you want to be able to have them signed electronically, this is how you'd create those. So you'll scroll to the bottom, you click Start Document. Any of mine that are in progress are up here at the top. If I click Start, we'll start this new one. We'll want to type in our client's name. Make sure I delete this out first. Let's save and continue. So the agent will need to initiate this. This isn't something that the consumer would start themselves. You'll still need to initiate it for them. You will read these terms and conditions and agree to them. Continue. And we'll go quickly through this ESOA. We'll say we're not in the same physical location. If we are, they can just do identifying information. So mother's maiden name and last for their SOCH. Otherwise, if we say no, it'll be an email signature link. Just like for the e-app, it will send them verification link and code, and they quickly do that. For this example, we'll just say we're in the same physical location so that we don't have to get that email while we're on this webinar. But then it'll just go through and the applicant will fill everything out, and then we'll sign and continue. And then we'll go back to our document locker here. And this is where all of your completed ESOAs can be stored. You can see I've created folders. So I have my 2020 AEP docs. I named it this. I can put anything in there I want. Or maybe I want to sort it by client. Maybe I want Anthony to have his own folder or Marie to have her own folder for her quotes. You can upload any type of document. So it's not just your electronic scopes. You can upload any sort of documents, or you can pull over your PDFs that you've exported for people's quotes, and you can pull them in here and easily sort them by folder so all your documents are in one place. You can also export this. So maybe you want to export all of your documents or your scopes that you have here. You can easily export them all at once, or you can even import or upload any of your documents. So maybe you have a huge stack or folder of your scope appointment forms sitting on your desk. Well, you can easily scan those if you have a scanner, and then click upload, and you can upload all of those in one place. So no more digging through your paper files. Upload all your documents or ESOAs and store them here safely in the document locker on your MedicareCompareUSA quoting and enrollment tool, and now a document locker as well. So everything's in one organized place. And that way, if you ever need to access these documents, you just simply go right here. And these are all, these ESOAs are all compliant, and they work for any of the carriers. It's a universal scope appointment form, so use it for any of your carriers. And you can also, like I said, you can also export these, but it keeps it all in one place for you. The last thing I was going to mention is that there is unlimited storage. So don't worry if you have maybe 500 of your scope appointment forms. We'll take them all. So there's unlimited storage here. Don't worry that there's a certain limit. You can keep everything here in one place. So let's go back to the dashboard. We went through everything that is on the tool here. Let's see if there's any questions that you want to ask. I'm going to check out our attendees and see if anybody's raised their hand or has a question on the tool. It looks like Doug West is our first person here that I see has a question. Doug, would you like to go ahead and unmute yourself and ask your question? All right, sorry about that, Doug. I went ahead and unmuted you. Can you go ahead and ask your question?
Yeah, it wouldn't let me unmute myself. It said you're muted by the organizer. So yeah, as you're running these quotes, I was wondering, does it just pull up the carriers that you're personally appointed with, or does it pull all of them up?
Great question, Doug. So it will show all of the quotes that are available. through this Medicare Compare USA portal. So you'll see all of the different carriers that they allow you to see. It won't be the ones that you're just personally appointed with.
Okay.
All right, let's see if we have another question here. It looks like Leslie Parker has a question. Leslie, I'll go ahead and unmute you. All right, Leslie, I'm unmuting you. Can you also unmute yourself?
Yeah, I just asked, and I think you already answered where the provider search tool you could access, and I think you shared that with us.
Perfect, yes. And just a reminder, that was in the original Medicare quoting tool, so this original one listed here, and it's under the Carrier Resources tab. So that's where you'd find that. Thank you, Leslie, for your question. Let's see if anybody else has any questions. Okay, nobody has their hand raised. It looks like we got Doug and Leslie taken care of. Let's see here if we have any chats that came through. It doesn't look like we have any other questions coming through. Alex, did you have anything that you wanted to add at all? Or anybody with Medicare Compare USA, did you want to add in anything or see anything else today? It looks like Alex may be self-muted here. Okay, it doesn't look like there's any other questions. Again, today's webinar is completely recorded, so we'll be happy to send this out to you. If you're interested in getting a copy of this or you'd like to rewatch it later, feel free. Again, thank you so much for taking the time to join us on this webinar today and go over the new features and the current features offered by Medicare Compare USA's online quoting tool. If you have any other questions, please don't hesitate to reach out. We're here to help you. And I hope you all have a great rest of your Friday and have a great weekend. Thanks again so much. Looks like we have one more question that came through. Sandra Anderson, would you like to ask your question?
I think I might have missed this. What is the cost of all this?
Great question. There is no cost. It's all included on the Medicare Compare USA online portal. So as long as you have access to that, this is provided to you through Medicare Compare USA. So there's no additional cost to you.
Okay, great.
Doesn't look like we have any other questions. So thanks again for joining us on today's webinar, and I hope you all have a great rest of your day and a great weekend. Thank you.